So as an oral pathologist, we also deal with dry mouth, or as we call it, xerostomia. That's the subjective sensation of dry mouth. So patients who are on a lot of medications, or patients who have had radiation to the head and neck, or patients who have an autoimmune disease called Sjögren's syndrome. All those types of patients often will have a dry mouth. When you have medications, oftentimes medications will sort of shut off your body's ability to produce the saliva just chemically. Also, patients who have had head and neck radiation or have the autoimmune disease, there are salivary glands throughout their mouth, and the major glands next to their ears, the parotid glands, and under their jaw here, those glands will be destroyed. So they just lack the ability to produce saliva. So patients with dry mouth, their mouth will feel like the tissue is kind of atrophic. Your tongue will stick to your cheeks or the roof of your mouth. You'll have difficulty chewing food. You'll notice that maybe you're developing more cavities or brown spots along your gum line. Your saliva may appear kind of ropey, white or ropey, and it won't pull, so to speak, in the floor of your mouth like it used to in the past. And you may just have difficulty with, again, eating or speaking. And it's not something that happens overnight. You may wake up with a dry mouth one morning, but this is kind of a chronic condition where patients will really just feel that their mouth is abnormally, dry, and it's really affecting their quality of life. And so, without saliva, you're at risk for oral discomfort and increased cavities and oral fungal infections. And so it's important for someone to manage these with medications that can stimulate salivary flow to provide patients with relief for their dry mouth symptoms, but also then to protect them from developing the oral fungal infections and increased number of cavities in their mouth. So we can deal with that with kind of salivary substitutes, or with something we call salagogues, or medications that stimulate salivary flow. And those medications can have effects. They can make you sweat, they can make your heart race. So it's important to have someone trained in using those. And one other thing that I deal with is oral fungal infections. So patients may they have a dry mouth, or may just have another medical condition like diabetes that predisposes them to a fungal infection. And so once we identify that fungal infection, we can treat that with antifungal medications as well.